Dr. Ted Naiman, the PE diet, standing for the protein to energy diet from his book. This video, Key Points, Part 2.
Well, there have been a lot of studies where they ask people to rate which foods they felt most addictive to or that they overate the most. The whole list of like the top 100 foods are just high energy density carbs and fats together. Basically refined carbs and refined fats. It's your pizza and your french fries and your chips and your donuts and your candy bars. You give an omnivore mammal a high energy density carb and fat together, it's going to automatically eat by 30 or 40% of calories. But we've also done studies that show that the combination of carbs and fats together is highly rewarding in the brain. It releases a lot of dopamine, not unlike an addictive drug. So it's literally a drug-like response in your brain. Now, I think you have to eat a certain amount of fat for satiety. And so you have to look at fat as something that's on a U-shaped curve. There's a certain amount of fat that's essential. You have to eat it. We have essential fatty acids we have to eat. You need a certain amount of fat for satiety, for gallbladder function. I don't recommend low-fat diets, however, because you're trying to solve the satiety equation. And personally, I think that the solution is to get the highest satiety for the least amount of energy. And I don't think that's at zero fat. So the two easiest ways to measure energy in your blood is glucose and triglycerides. Glucose is sugar energy in your blood. Triglycerides is fat energy in your blood. And if you're nice and thin and you've got plenty of room in your adipocytes to store energy, when you eat a meal with a bunch of carbs and a bunch of fats, your fat cells literally just suck that energy right out of your bloodstream. And so we have these studies where lean people eat a bunch of fat and the fat cells just hoover the triglycerides right out of their bloodstream, and your triglycerides stay nice and low no matter how much fat you eat. Same thing with glucose. If you have plenty of room in your liver glycogen and your muscle glycogen to store glucose, you can eat a bunch of carbs and it literally just falls out of your bloodstream down a concentration gradient into your liver and your muscles, and it's gone. So if you have really low fasting triglycerides and glucose, then you're probably insulin sensitive and you probably have plenty of room for energy storage, both glucose in your glycogen, liver and muscle, and fat in your adipocytes. The problem shows up when you start to have high triglycerides and high glucose. Typically, you will see high triglycerides first. And high glucose is actually the very, very, very last thing to show up with insulin resistance. We'll see increasing waist circumference, high blood pressure, high triglycerides, low HDL, all of these things first. And then the last thing in metabolic syndrome or insulin resistance is high glucose. So I love looking at triglycerides because it's going to be elevated in 90% of people with metabolic syndrome, and then glucose might only be elevated in 10%. So a really good rule of thumb is that you want both fasting glucose and fasting triglycerides to be under 100. So I'm talking about a 12-hour water-only fast, no calories, no coffee. If you fast for 12 hours and both your glucose and your triglycerides are 99 or lower, below 100, you're probably doing okay. Once your triglycerides are over 100, you're probably dealing with some amount of insulin resistance. And by the time your glucose is high, you're really screwed. I mean, you've seriously got a problem. Like, I will see lab reports back to a patient from my peers, and their triglycerides might be really high and nobody even comments on it. I mean, in the textbooks, we are only supposed to get excited if your triglycerides are over 500, and then we're supposed to put you on Tricor or niacin or one of these prescription type things. And so we really don't get excited about triglycerides till they're, 500 or 1,000 in terms of just the medical community. And the horse is so far out of the barn by then. It's just really terrible.
What are the most addictive foods? Refined carbs and refined fats together. We need a certain amount of essential fatty acids and fat for satiety, however. To measure energy in the blood, glucose is sugar energy, triglycerides is fat energy. If you are insulin sensitive and you eat a meal with a bunch of carbs and fat, the fat cells will literally suck that energy out of your blood. If you have really low fasting triglycerides and glucose, you're insulin sensitive. To check for insulin resistance, waist circumference, If over half of your height, high blood pressure, high triglycerides if over 100, low HDL. In getting your blood checked, the last thing to appear, high glucose above 100. The problem is, according to Dr. Naiman, medical textbooks and current clinical practice in many cases, they're only concerned if the triglycerides are above 500 to 1,000, and then they prescribe medication. By then, the horse is so far out of the barn.